Fetal Heart Rate 5-Tier by Jennifer Myers. Um, so I decided to pick fetal heart rate monitoring because my specialty is labor and delivery. And this app came to mind as in a good thing to use. It is able to be used on an iPad or your cell phone. This 5-tier app is an app that breaks down over 134 possible fetal heart rate combinations into 5 colored categories. The app will calculate the severity of decelerations for the healthcare professional so that information can be given quickly. Some decelerations need more instant intervention than other decelerations when we're dealing with babies. The app colors are into green, which is no acidemia, no intervention would need to be used. Blue, yellow, orange, or red are evidence of actual or impending fetal asphyxia. Rapid delivery is recommended. The app, when you put stuff in, the things are color coordinated, as you will see in a later slide. This app benefits OBs, midwives, and RNs, and it can be found on the App Store. This one is specifically searched for the Android. Goals of this application are to take those 134 possible fetal heart combinations and put them into 5 categories. They will have a quicker intervention. It helps with calculating. It will also give recommended interventions. It also says that this is to not take the place of healthcare professionals and what we know in treating our mom and our babies. It does give pictures for what the heart rate you're putting in, the deceleration, what you're possibly seeing earlies, and then it will give you a color of the slide and it will tell you how to go on. The usability of this app, it was very organized. I was able to easily navigate it. It cost me $2.99, which to me is worth it if I can look at something really quick that's in my pocket instead of having to go to a desk and ask my charge nurse, or pulling out a book in my pocket. It's just something that is very hands-on. The information does go in order, so you can get a step 1, step 2, step 3, step 4, step 5, etc. The color boxes are bold, so it pops in the eye instantly. If you see a bright red, then you know you're in trouble. These are some slide pictures. That one is a step 1, which is a variability marked moderate and minimal. For labor and delivery words is how the baby's heart rate is. We always want our baby in moderate, which is 6 to 25 BPMs. You don't want absent or sinusoidal. It's just like with the adults, it's not good. And marked means we have an overstimulated baby. Minimal means we have a very little stimulated baby. And then you can see on step 3, it goes over decelerations. And underneath decelerations, it says with 50% of contractions. So that lets us know that this isn't happening with every contraction, but it's happening with 50% of our contractions. So we can also pass that information along to our healthcare professionals. The usability, again, of this slide also gives definitions. Like the note on this is decelerations must occur with over 50% of the contractions and in any 20-minute given period. When we look at heart rate for our babies on our monitors, because when we're labor and delivery nurses, we don't take care of one baby, one patient, we take care of mom and a baby. That we also want to be able to pass this information. And there are a lot of times we are 2 patients to 1 nurse, and we may have moms that are going head to head. We don't really know who's going to deliver first, and sometimes it's just it can be crazy on labor and delivery. So this reminds us of our definitions, reminds us of what we're looking for, reminds us where we need to go after this. The legal, ethical, no information, patient information can be put on this app. You're going and specifically looking like for the heart rate. If your baby's heart rate is 155, has been there for 20 minutes, and over 50% of the contractions, when you're at the peak of the contraction, dips into the 30s, you know you probably have a cord around the neck and your physician should have been notified. So that makes this app very HIPAA compliant. It does give appropriate medical and nursing recommendations. It also gives appropriate definitions for what we are doing. Analysis, the pros, I found it was very helpful. Um, it does the work for you, gives appropriate recommendations. Color coding name makes it awareness greater. Information is very straight to the point and it's easy to download. Cons, I couldn't really find a lot. I did go outside, so I was not attached to Wi-Fi, and it seems to run slow or it'll get stuck. Um, some people from my research said that they didn't like the flow of it. When I looked through it, I didn't seem to find it. I very much enjoyed the app. I actually will now keep the app for when I go back to work. I found it that great of an app. I truly hope you enjoyed, and there's my reference. I truly hope you enjoyed my presentation and have a great day.